Well, think the health care reform battle is over? Think again, unfortunately. President Obama is planning a new PR offensive. The White House is preparing talking points for lawmakers who could get some tough questions from their constituents. While Republicans hope to use the issue to retake the majority on Capitol Hill next year. The GOP is planning daily reminders of the coming tax increases, also Medicare cuts. So what sort of impact will health care reform have on the November midterm elections? That's what we're talking about next with Ron Bonjean, a former communications director to House Speaker Hastert, and Maria Cardona. She's a former communications director at the Democratic National Committee. Nice to have you both. And Maria, I'm going to start with you.
Thank you.
You have 7 months, the Democratic Party has 7 months, to kind of turn around this image of health care reform and make it more positive than arguably the last year has been. How are you going to do it?
I think we're going to do it very simply by clearly communicating to the American people the way that President Obama has in the last 3 weeks about what is in this bill. The fact that 32 million Americans will now have coverage, the fact that children will not be able to be turned away by insurance companies for pre-existing conditions like diabetes, asthma, epilepsy, the fact that parents will now be able to keep their kids on their insurance policies until they're 26 years old, and the fact that, that small businesses will have tax credits to be able to offer their employees health coverage. All of these things are incredibly popular initiatives. They're in this legislation. They come into effect in the next 3 to 6 months. It will be very difficult for Republicans to run against those initiatives. But if they want to, I say bring it on.
Well, and let's talk a little bit about that, Ron, because some of those bullet points sound pretty good. You know, the Republicans have been unanimously against this. So have you dug yourself a hole that you really can't get out of if suddenly the public starts supporting this bill maybe more than in the past?
No, actually the Republicans have been on the side of the American people. The American people didn't want a health care reform bill. They wanted a jobs bill. And so President year and a quarter has been focused on the sausage-making process, the buying of votes, the special deals, the backroom dealings. And now they're just getting started to talking about the benefits of the bill. They have their work cut out for them because the bill, in fact, cuts Medicare, which is going to hurt seniors. It's going to hurt small businesses with unfair mandates. It's going to especially hurt states with increased Medicaid rules. In fact, this weekend, Arizona just announced that they're going to drop the whole S-chip program for children because they simply cannot afford it. So as we move on, there are tons of House Democrats who voted for this bill, a lot of them who have flip-flopped, that are in the danger zone. They're going to have to answer to their constituents why they voted for something like this when they didn't want it.
What do you think about this idea that this could backfire on both of you? Maria, you can start first, and Ron, you could go second, with the fact that there's been a lot of criticism on both sides. The Democrats being out of touch and kind of passing this at all costs, and the Republicans being sore losers and just kind of throwing these complaints at this process and slowing it down. It could backfire on both parties, and then you have to fight against some of the independents come November. So Maria, starting with you, and then Ron, how do you do that?
Well, I think that we have to make it very clear that we do understand the anger that is out there about how Washington has not been working for the American people. I think we have to make it very clear that President Obama from day one tried to work with the Republicans on this legislation. In fact, the legislation that was approved last night contains 218 Republican amendments, and the state health care exchanges a Republican idea. But at the end of the day, how many votes did that get President Obama? 0 Republican votes. We also have to talk about the fact that in all these polls that we've seen where 46 to 49% of the American people do not like President Obama's plan, the fact of the matter is that 10 to 15% of those people didn't like it because it didn't go far enough, because it wasn't liberal enough. So we presume that those people at the end of the day will support this plan because they know that it is much better than what we have today, and that it will in fact help us to go on the road to financial recovery.
Ron, your thoughts?
Yeah, I would have to say Republicans are on the right side of the American people. They are in sync with independents and conservative Democrats. Just look at the state of Indiana, where Brad Ellsworth, who's rumored to be the likely Senate Democrat nominee, he's in a state where he voted for health care. The state is 60% opposed to the health care reform bill. That's his introduction to the whole state when he runs for Senate, is that he is for health care, that he voted for something that Indiana citizens didn't like. That doesn't make much sense to us. We're for repealing the health care reform bill and replacing it with things that make sense.
All right. Well, Ron and Maria, obviously the battle's not over yet. We're going to be talking to you guys certainly down the line. Thank you very much.
Thank you so much.
Thank you.
Just crossing the urgent wires right now, we have just found out where President Obama will travel on Thursday to kind of unveil this health care signing, if you will. The bill, by the way, will be signed tomorrow, we presume, in a Rose Garden ceremony. And just crossing now, the president will go to Iowa City, Iowa.